Welcome to the video tutorial series, Press Ganey Improvement Portal for Medical Practices. In this module, you will learn how to read the Practice Question Analysis Frequency Analysis report. Here's a look at the top of the report. On a site, you will actually see the site name in the upper left corner of the report. This report was ran for all of Florida Hospital Medical Group, so it does have multiple sites rather than a specific individual practice site. As you can see, coming on the screen is an option to save the report or print the report in its format. The first item on the report is the filter section when we ran the report, and it shows which sites were selected. Since we ran this for all of Florida Hospital Medical Group, all Florida Hospital Medical Group locations, sites have been selected. So I'm going to continue to scroll down until we get to the next section, which is the receive date filter. This report was ran for a year to date, so it is showing the first of the year to the current date of the report was ran. An adjusted sample was included because the Florida Hospital Medical Group is part of both paper survey and e-survey, so an adjusted sample is included. The benchmarking period always shows the last 6 completed months in the survey. The benchmarking group should be all respondents. And then finally, the distribution. Since this was ran for Florida Hospital Medical Group, it is at a facility level distribution. But when running for a report for any individual practice, the distribution should read site at this point in the report. Scrolling down, we then move to the actual question analysis portion of the report. There are 3 basic sections that I like to refer the report at. It looks kind of like 2 with the dividing line here. The first section that I like to refer to are just the questions. The next set of the report is the mean and the n size, and then finally the rankings that are off to the side. So we're going to go into the sections first. There is an overall, which is an overall calculation of all the questions that were asked. The following sections are access. Access are those questions that are related to ease of getting clinic on the phone or the office hours, anything prior to the actual visit. There's moving through the visit, which is talking about information about delays and wait times. There are a couple questions on the nurse or the medical assistant in the medical practice survey. And then there are 10 questions on the care provider in the survey. So there's the care provider section. There's some personal issues that questions are asked, and then finally an overall assessment. There is one non-standard question that is asked in our medical practice survey. That non-standard question has a little cross after it, and it is our promptness in returning calls. After we move through the questions, I'm going to move over to the mean score. The mean score is calculated by taking all the 1s, 2s, 3s, 4s, and 5s that respondents provide in the surveys. They are converted to a point system and then calculated into a mean score. This we'll discuss a little bit further when we get to the frequency analysis. But you can see each question has an individual mean score. The mean score is calculated by the number of actual survey returns or responses. So you can see there's a total of 12,860 survey returns, and currently there's, under the ease of getting clinic on the phone, there were 12,453 responses. So not everyone responded to ease of getting clinic on the phone. Maybe a person left that blank. The instructions on the survey say leave it blank if it doesn't apply to you. Maybe this person made their appointment online and they didn't need to get anybody on the telephone. Okay. Finally, after we see the various and n sizes, the number of responses for each question, we'll go over to the rank and what that rank means. Our goal throughout Adventist Health System is to be in the top quartile performance overall. We are currently at the 76th percentile for our year-to-date, as ranked by all other facilities that utilize Press Ganey in its national database and surveying. If you break us down and we go to Region 4 of the American Hospital Association, you can see that there is a fewer N size of respondents. There's over 1,000 facilities that utilize our services through Press Ganey. The American Hospital Association Region 4 is just a smaller set of the United States, meaning the southeast portion, which includes Florida Hospital Medical Group in the state of Florida. There's only 139 facilities within Region 4, and so we're being compared against those, and our ranking has gone down a little bit. AHS Peer Group is comparing us against everyone within the Adventist Health System, and that N size is 20. There's 20 other medical practices that we're being compared against in Adventist Health, and then our ranking drops a little bit more. But for sake of comparing ourselves and ranking ourselves, we always go by all sites or all facilities. All facilities for FHMG, each individual practice will be, and all sites will be on their report. Numbers in red just mean that they're below the 50th percentile. If they're in blue, they're above the 50th percentile. Even though we're not quite at top quartile performance, it's still above 50. That's the only meaning on the report as to why a number is red or blue. The next section is the frequency analysis. The frequency analysis is going to show the distribution of responses throughout the survey. And this is a great tool to use when working on an action plan for your site-specific action plans in your practices. Using the frequency analysis, you can determine which scores were given. As you can see, as we look at the standard overall, over 80% of our patients gave us 5s on our survey questions, over 80%. About 15% give us 4s, and you can see less than 5% total give us 1s, 2s, and 3s on our survey. These ratings of very poor, poor, fair, good, and good are the 1 to 5 ratings on the survey. These are what's converted into the points calculated for the mean score that appears in the question analysis at the side here. Should you have further questions or need additional assistance, please contact a member of your consumer experience team. This concludes our tutorial video on how to read the practice question analysis and frequency analysis report.